call upon Dr. Navneet Toshniwal. He is from Solapur. Is the best phaco surgeon. Is teaching phacos to the fellows, and you can come here again.
Thank you, sir.
And
If there
now,
are any questions or anything, whenever you want to
now
take the
he
questions, we
he
can.
will speak on the different phaco techniques. Dr. Navneet Toshniwal.
Uh, Thank you, respected Lane sir, my teacher, Dr. Ragini. This time, this is the very interesting heading, the different techniques for different grades and types of nucleus. That is the very important type that soft and hard we consider always. But what is this different type? Now we have just mentioned that sticky cataract, leathery cataract, all this is interesting words are the type. That is the reason this is interesting. I am showing first presentation is a hard cataract. Different techniques means it is a just not technique, it is instrumentation, it is the parameter. All are important. I am doing routinely stop and chop technique, and most important part is this central cracking, which Dr. Lane sir had shown that it is always, many times it is leathery, and this is a pre-chopper what I am using, so it is a different something and new tool. You can pre-chop after trench one time, two time, all the time it is equal pressure. So there is a no more pressure on a zonules. This we can attempt till we can crack the central leathery fibers. This is, I think, very important. Then you can attempt with your two tool, that is with the dialer, with the chopper, and try to crack it. Most important thing is that there should not be pressure. It is not very easy step, and that is the reason you cannot do directly go and start hard cataract immediately. But once the nucleus is divided into two pieces, then what the sir has mentioned, bury the nucleus with the tip. So whole chop is important, but most important is the burying. Chopping is easy, but hold is important, where high vacuum, high flow rate is important for that particular step, and your angulation also. Going down towards the nuclear mass is very, very important. Protection of the endothelium with the good viscoelastic is very important. You can see the cracking is always important, and I think partial cracking is possible and important, so that apex can attach with each other and you can remove the pieces brilliantly. So it's a parameter, it's what machine you are using and all that. Madam has rightly mentioned about the different varieties. Soft cataract, you feel it's very easy. It's the most challenging situation in a phaco surgery. Different way to deal, and although it is soft, some of the nucleus are very small. So just you can remove it out with the visco expression. And sometimes when you try to do the delineation, dissection, whatever it may be, now here it is the size of nucleus. The size of nucleus is big, so it cannot come out easily. And here you have to go in to do some procedures. So now I'm trying to lift it out. What the madam had shown, Ragini had shown, that lifting out at a supracapsular plane. But it is not coming out. So another simple view, first just remove the epinucleus which is in the view, make the view clear, and again the stop and chop technique. So soft variety is completely different, and here again the role of pre-chopper. That is very important. You cannot divide this nucleus with your phaco tip chopper, not very easy. With the two instrument, not easy. So it's a pre-chopper, and you see the perfect crack. Now the most important point is this. Now I am demonstrating with the two instruments. They pass through the substance. So you cannot divide that. That is the reason you need a plate-like instrument to do this, because soft cataract, all-time challenge. You cannot do nice SICS. You have to do phaco. You need instruments. I think that is very important. Again, a hydrodelineation, lamellar dissection of the multiple layers is the very important in a soft cataract. Here I have done delineation to see, to judge my size of nucleus, what size of nucleus I am tackling, and hold is very important. So this is called as the visco expression of the half side of the nucleus out. We are brilliant SICS surgeon. This is what we are doing every day. So stop and chop means trench, divide into two, lift the half piece with the visco, bring it at a supracapsular plane. This is very important. Don't try to tackle this soft nucleus inside the bag. Mature cataract, this is the microcapsulorhexis forceps, very brilliant tool that work as a needle, that work as a forceps. Try to decompensate the nucleus. That is very important. If it is not full, it will no liquid will not come out, but try to do that. Then micro Caesar is important to extend that nucleus and then complete with this forceps. What is the significance of this forceps instead of needle? You sometime it go near to iris, as you see, and you can control with the forceps. Sometime with the needle, if you try, you may touch to the iris and pupil can get small in a difficult situation. Another very important in a mature cataract, you cannot predict the hardness and size. So when you start with the first strokes of the nucleus, you get the idea that, yes, this is my hardness. So this is called as a feel the nucleus. This is another very important point. Then you can automatically go for the safe nucleus management. So accordingly, I will judge that what is my density, because in mature cataract, you cannot see before exactly what layers, how much layers it is involved. Try to go in the center. This very nice groove you can see, divide it into two pieces. Once you divide into two pieces, rest of the things are not very difficult. Lift it out from endocapsular to supracapsular plane, but at the level of rhexis, at the level of pupil, and try to chop. Hold is again important. Chop, these are all the horizontal chops. No need of chopper unnecessarily continuously. That will give the better phacofluidics. That is very important. And tackle the other half of the nucleus. Here I want to mention, no need to rotate unnecessarily, move the pieces unnecessarily. That will give pressure on the bag. So this is what you have to try to avoid it. Not very easy to touch these nucleus at its position, but when you embed in the nice plane, you can chop brilliantly. And already I told, it is not always complete chop, partial chop. Fix the apex to apex. That is very easy to tackle the rest. Otherwise, these nucleus pieces are wandering here and there. So if it is partial, they stay there. You can hit, be in a center, just behind the center, and you can tackle it in very well. So I am very much thankful to Dr. Ragini madam that the heading is so beautiful that different grades, not different grades, it is a different types of nucleus and how to tackle it. And your technique, your parameter, your instruments, all are important for tackling this situation. And I am thankful for another point that these different types of nucleus, I have written a second book where when I started writing, I got the 42 different types of nucleus, and I have mentioned in that. And sir has only given the forward for this book, and I am again thankful everyone for this patience raising. Thank you.
Well, thank you, Dr. Toshniwal. That was a wonderful talk. specifying about how you can tackle all the different grades of cataract. As Lahane sir has mentioned about the hard cataract, madam has told about the very soft cataract. There can't be fixed rules. Of course, you need to follow the norms of it, but then every cataract has to be tackled in a totally different way, like Dr. Toshniwal also demonstrated. So it's a totally different ball game. Every cataract is different cataract, but you need to observe and follow and take guidance from the senior phaco surgeons and do case